Well, everyone, welcome to the August 2026 version of Data and Donuts. We really appreciate everybody being here. I'm speaking on behalf of Vicky, whose voice is questionable. So welcome, it's really good to see you. My name's John Neal, one of the founding members of Data and Donuts, and so I'm super glad everybody's here. Welcome to Lacey. If you have never been here before, this is an amazing place. But also recognize that it is an office for a lot of people, so be respectful of that. Restrooms are over here, all that good stuff. Also, thank you to Compiler LA. They are the infrastructure that makes this happen, so I'm very thankful to this team. This statement is not exactly true at this point. That was our technical issue. We're going to be recording this and making it available to folks later, so unfortunately the live stream is not operational. We will not be recording the questions at the end, however. So there are some job boards. This is in the deck that you can grab off of the site, I think, after the presentation. But there are a couple of specific jobs at LA County, a data science supervisor. You see that. It's interesting because when they put together the names of these jobs, I really hated this one. This is basically a chief data scientist position. It makes it sound like you're, something different. So anyways, also at SCAG has got an architect position as well as LA County Harbor. So upcoming events, we're going to be back here on September 24th, and we're going to have the Madeline Brosnan from UCLA. So hopefully you'll join us for that too. Okay, let me introduce our two speakers today. We have Claire Battis from the Homelessness Prevention Unit from the new County Department of Homeless Services and Housing. It's a brand new department with, I'm sure, all of its growing pains and stuff, so I'm very interested to hear about this. And then we also have Brian Blackwell, who leads the California Policy Lab's data science area. So without further ado, I'm going to let them get started, and the floor is yours. Thank you, everybody.
Hi, thank you. Thank you, Data Donuts team and Compiler team for having us. Thank you, everyone who woke up early, or what I consider early as a night owl, to be here and hear more about our work with data-driven homelessness prevention in LA County. My name is Claire Battis. I am the lead data program manager for the Homelessness Prevention Unit, or for short, we call it the HPU. The HPU started as a collaboration between the Department of Mental Health, Department of Health Services, Housing for Health Division, and UCLA's California Policy Lab in mid-2021 with the goal to identify county clients who are most at risk of losing their housing and then try to intervene and prevent that from happening. So we started as a small team of 7, and we've now grown to 40 with 20 case managers. We serve up to 700 clients a year. And I'd love to kick off the presentation sharing a story from one of those clients, because I think it just gives a good glimpse into some of the work we do with our clients and the challenging circumstances we find them in when we first meet them. So Brianne was living with her mom and grandfather in her grandfather's home up until a few years ago when her grandfather passed. Afterwards, Brianne started experiencing sudden and unpredictable seizures, and they both fell behind on bills. Things snowballed. They quickly lost the house. They were forced to couch surf with various family members, friends, even ex-partners, living out of living rooms. You can imagine there was a lot of tense interpersonal household dynamics going on. And not only did this really weigh on Brianne's mental health, but her medical issues started to worsen. And at the same time, she was not able to get proper medical evaluation, treatment. She didn't have consistent access to her medication because she didn't have a stable address. She didn't have transportation. She didn't have consistent access to a working phone even. So at this point, Brianne has remarked that everything in her world was about to collapse. And luckily that is when we reached out and we connected with her. We were able to assist Brianne with paying off some significant debt that had built up over the years. We've assisted with transportation to her medical appointments. We connected her with mental health services. We linked her to our county benefits entitlement team so she could apply for disability. And finally, we were able to move Brianne and her mother into a subsidized permanent housing unit and a place that they could finally call home. I think Brianne and her mother have been living there now for a year, and Brianne has said that her medical issues have finally been properly diagnosed and are under control. So I'll pass it. I'm going to pass it now to Brian to tell you more about how this initiative came to be and some more data sciencey stuff.
Thanks so much, Claire, and thank you so much to the organizers of Data and Donuts. This is a really great event. It's a wonderful space. It's really fantastic to be here. So before I get into the details of the Homelessness Prevention Unit, I just want to say a little bit about the California Policy Lab, where I work. So CPL is an independent research institute at the University of California. We have 2 sites at UCLA and UC Berkeley. And our mission is to develop long-term partnerships with government agencies to use the power of administrative data and quantitative data analysis and experimentation and quasi-experimental and experimental research to really move the needle on important public policy questions. We work in 6 policy areas of criminal justice, education, homelessness, labor and employment, the social safety net, and health. I'm just going to try and adjust this mic so that I'm not kind of leaning over. Well, that's okay. So I'm going to set the stage a little bit for this topic of homelessness prevention. So you're probably aware, if you live in Los Angeles, of the sheer scale of the homelessness crisis in LA. So according to the last homeless point-in-time count, about 73,000 people are experiencing homelessness on a given night in Los Angeles, and that represents a 38% increase since 2018. So there is an increasing recognition among policymakers that in order to make a serious dent in this problem, not only do we need to house people who are currently experiencing homelessness, we need to do something to try and prevent homelessness before it happens, right? So that's really the policy motivation here. And I want to take a couple of data points from a really fantastic survey coming out of UC San Francisco, the CASPE survey of people experiencing homelessness. If you're interested in homelessness, it's really one of the first things that you should look at and look into. It's the largest survey of people experiencing homelessness ever conducted in the US. So one of the things that it found was that most respondents said that a one-time payment of the region of $5,000 to $10,000 could have prevented their becoming homeless. So this really motivates the idea that short-term flexible financial assistance could really potentially be effective in preventing homelessness. Another important data point was that almost half of respondents said that they weren't the primary leaseholders at the time that they became homeless, right? So this really clarifies the policy landscape. So a lot of the time when people think about preventing homelessness, they think about things like tenant rights, eviction defense, housing supply, housing affordability, and all of those things are absolutely critically important. They're critical pieces of an overall kind of housing and homelessness landscape, but because of this very large percentage, almost half of people experiencing homelessness not being primary leaseholders, we need to think about other homelessness prevention services that can potentially serve that population. So given that policy context, can homelessness be prevented before it happens? Well, the good news is that there is an increasing body of pretty rigorous quantitative evidence that suggests that targeted homelessness prevention programs focused on short-term flexible financial assistance with wraparound case management, can be effective at reducing homelessness. We've seen this in Chicago, New York, Santa Clara, experimental evidence, quasi-experimental evidence. So that's, I think, really good news. A challenge with these programs, however, is that they require people to self-identify as being at risk of homelessness. So first of all, you need to recognize that you're at risk of falling into homelessness, right? And then you need to be aware that these homelessness prevention programs exist. You need to have the wherewithal to get things together in your life, to self-present to a homeless services provider. You need to get all your documentation and proof ready. So those present some pretty considerable barriers to finding people at high risk. So a question that we've been working on at the California Policy Lab really since CPL was started in 2017 and since I joined in 2018 is, can predictive modeling or predictive analytics, machine learning, AI, whatever you want to call it, can this be used to help predict homelessness before it happens? And since we're all here today, the answer to that question is yes, and the culmination of this work is a pilot program. I guess it's more than a pilot now, it is an actual real program in the Department of Homeless Services and Housing, the LA County Homelessness Prevention Unit. I do need to update the core partners here. So it was originally with DHS and DMH and CIO, but now the Department of Homeless Services and Housing. And it takes an innovative, proactive approach to homelessness prevention. And that is really enabled by the use of predictive modeling, right? So instead of waiting for people to show up to the door of the homeless services provider and self-identify, the Homelessness Prevention Unit actually goes down a risk list of people that are identified by a predictive model that was developed by the California Policy Lab. And Claire will go through the workflow for this, but they go down the list and actually try calling people on the phone to try and reach them and offer them enrollment in the Homelessness Prevention Unit. So I'm going to talk a little bit about the predictive model. Obviously, this is a huge kind of technical topic. Happy to get into more detail in the Q&A. I'm just going to hit some of the highlights here. So we're very lucky at CPL to have a data sharing agreement with the LA County Chief Information Office, where we receive a fully de-identified mirror of the Information Hub data, which is a really incredible linked administrative data set from about 10 county agencies. It covers health, mental health, social safety net benefits, the criminal justice system, and the homeless services. So that's the data source that we use for building the predictive model. Now, when you're building a predictive model, you obviously need a prediction problem. So in our case, because this is an intervention which is housed originally in the Department of Health Services, now HSH, what we're doing is we're trying to predict homelessness among about 100,000 stably housed users of county health services each year. And if we look at the base rate of homelessness among that overall prediction population, it's about 7%. So with the predictive model, what we're trying to do is essentially make some kind of meaningful improvement on that 7% number and find a higher risk group. So the predictive model, the algorithm, somewhat unsurprisingly, is boosted trees. We're dealing with administrative tabular data. That tends to be the highest performing algorithm. And the predictive model is able to identify a high-risk list of about 10,000 people each year. And that high-risk list is about 3.5 times more likely to experience homelessness than the prediction population. So the predictive model is making some meaningful progress towards helping solve that targeting problem with homelessness prevention. I should also just mention that there's nothing magical about this 10,000 number. It's not some objective statement about the number of people who are at risk of homelessness in LA County. It's really just a function of program capacity. And also the fact that we were running a randomized trial, so we needed a control group. So once you plug those numbers into the formula, program capacity, a few other factors plus the need for a control group, you kind of end up with this 10,000 number. So that's kind of the referral list for HPU. So with the increasing deployment of predictive models and AI and related technologies across society, there are, I think, very justified concerns about issues around equity and privacy. I just want to point out that these considerations were built into the HPU project right from the beginning. At CPL, we've worked very closely with Dana and Claire and her team to make sure that we're really thinking about equity and privacy throughout not just the predictive model, but the whole program, right? So in terms of privacy, the predictive model is built using fully anonymized, de-identified data that's stored in a secure data hub. So the CPL research team never sees any personal identifying information. And in terms of equity in predictive models, algorithmic fairness, obviously a huge topic. I would suggest you look at our technical report on the CPL website if you're interested in some of the details around this. But we use a pretty common method of comparing error rates across race, ethnicity, and gender groups. We focus on false negative rates, and we don't see any evidence that the predictive model introduces inequities in the way that people are selected for the program. I would also point out that equity is also not just about the predictive model. That's just one part of the program, right? So when people are selected by the model, they enroll in the program, or maybe they don't enroll in the program, they're offered services, they exit the program, they experience outcomes. So something that we've been very intentional about is thinking about equity throughout all of those different program stages. So what makes HPU unique when compared with other prevention programs? I'm going to point out a couple of things which are really interesting. So this proactive outreach approach, which I think is really enabled by the predictive modeling, really means that HPU is reaching underserved populations that wouldn't otherwise be served by existing prevention programs. So Los Angeles does have prevention programs which operate through traditional self-referrals, right? Now we did a little analysis, this is going back to 2019 data, but we did a little analysis where we looked at the populations of those prevention programs and then compared them to the HPU high risk list. And we found that there was almost no overlap, right? So these are really identifying distinct populations. So I think this is a really undersold advantage of using predictive modeling, right? You can identify these latent subpopulations that aren't being identified by existing programs. Another very interesting and distinctive aspect of HPU is that I think really in virtue of the nature of the predictive model and the predictors or features that it's using, it identifies participants with intensive service needs by comparison with those who self-identify for prevention services, right? So HPU participants are more likely to have diagnoses related to mortality, serious mental illness, diagnoses related to substance use disorder, and they're more likely to have criminal justice involvement. And again, I don't think there's anything magical about this. These are the features or the predictors that are used by the model, so it makes sense that it's going to find people who have elevated levels of these kind of prior risk factors, but it does necessitate a different approach and a different program model. So I'm going to hand it back to Claire to get into that.
So this diagram gives an overview of how individuals go from being identified on the models list to enrolling in our program. So once the predictive model generates a list of folks who are at high risk of losing their housing, that list is sent back to the county fully de-identified and then sent to our team at the HPU in the form of client IDs and medical record numbers and not much else. So we really just see a list of numbers, but no names, no contact information. So my team takes that list and we actually work across 5 different county administrative databases to look these IDs up, find out who these people are. We piece together names, client contact information, service histories. We also scan the records to do a little bit of an additional eligibility screening, largely just to determine if this person or household is already experiencing homelessness and would otherwise not be a good fit for a prevention program. At this step, eligible prospective clients are then randomly assigned to a treatment or a control group, which Brian will talk about in a bit as part of our impact evaluation. But those in the treatment group get passed on to our outreach team, who will attempt to get in touch with everyone on that list based on the contact information we found in the record review process, and hopefully enroll clients in our program. Before we talk about what happens when someone is enrolled, I want to take some time to talk about the outreach process, because proactive outreach is a very critical and unique part of our program, but it's also quite challenging. So essentially, we are cold calling our clients in a way that feels very out of the blue for them. This is very different from traditional prevention programs, as Brian said. Folks aren't looking us up online and calling in or sending an application, or providers are not referring people to us. Our clients have no idea who we are when we reach out. And over the course of the month, we call every number we can find. We'll send a letter to every address we have on file for someone. We'll send emails if we can find an email address for them. We'll even contact someone's clinician if we find in the systems that they are still actively working with a county or county contracted provider. So we pull out all the stops to get in touch with these folks. And it is very challenging. So we have folks who have an understandable mistrust of systems, people who are skeptical about picking up the phone and trusting an unknown person offering money. We have people, as Brian said, with complex medical and mental health challenges, so folks that aren't always in the same place or have access to a working phone, like our client Brianne. These are folks that are very challenging to get in touch with and serve. In the early days of the program, we didn't even have an outreach team. We would have case managers actually do outreach to their own clients while juggling an active caseload of clients. And we started monitoring our data, testing out new strategies, and then in 2023, we actually launched a dedicated outreach team who specialized in just that. And I'm really proud to share that we've gone from enrolling 1 in every 5 folks that we've outreached to now 40% of the folks we outreach to. Our biggest barrier to enrolling clients still remains just like the ability to simply get in touch with them at all. So we'll call numbers that are out of service or disconnected. We'll leave voicemails that go unresponded to. Some other trends we've seen, we're more likely to contact and enroll women over men. Same goes for our families. We're more likely to enroll families than single adult households. So although doing this type of outreach is challenging, it's also critical to be able to reach highly acute populations who would not otherwise connect with prevention resources themselves. So folks who we are able to contact and say yes to enrolling are then moved from outreach team and assigned to a case manager whom they will work with for the next 4 to 6 months. I consider our main intervention kind of twofold. So first, clients receive very flexible, no strings attached financial assistance. Our single adults get a minimum of $4,000, while our families are offered a minimum of $6,000. Along with financial assistance, we provide intensive case management support. Our case managers will also make referrals and linkages to other services and resources in the community, like behavioral health services, employment, income building services, legal services, just making sure they are plugged into long-term systems of care that can help them sustain their housing after they exit our program. Several key features that we try to be intentional about and we think are really critical to our success are the first two I actually consider very similar. We try to be as accessible and client-centered as possible. So as I mentioned earlier, we are appearing in clients' lives out of the blue. From there, we want to make sure we're as low barrier documentation-wise as possible. And this is quite different from other like rental assistance and prevention programs. So we don't require clients to show us a copy of a lease or proof of residence. We don't ask people for bank statements or proof of income. You don't have to prove your need to us. If you are on our list, you're largely in. And then when I say our FA is flexible and our financial assistance is flexible and client-centered, I really mean it. Our service plans are driven by client needs. We don't just stop at rent or utilities. If someone has debt, we will help them pay their debt. If they have transportation needs, we'll help them fix their vehicle. We'll help folks with groceries. We'll help folks buy new clothes. I can't tell you how many clients I've heard say, just how grateful they are to be able to send their kids to school in clothes that fit, or have clothes that fit themselves and they feel like themselves again. We also have a low caseload size to ensure our case managers can provide really tailored hands-on support in the little time that they have with clients, because that 4 to 6 months when we're finding clients in times of crisis, it really flies by. We have a ton of baked-in support staff. So in addition to our data team and our outreach team, we also have a linkages and referrals manager who is our expert on community resources and creating pathways that our clients and case managers can use. We also have an in-house housing navigator who will help clients if they need to relocate. We're really proud of our staff retention. We believe case management services can only be high quality if our staff feel supported and well taken care of, and they want to stay and be a source of consistency in our clients' lives. Finally, we monitor equity at every stage of our program to ensure those who show up on our list are the same folks who make it through to outreach, who are the same folks who make it through to enrollment and discharge, and there's no one population disproportionately falling off at any stage. So this is a bird's eye view of our participant demographics. On the left, you can see, as we mentioned before, we're much more likely to enroll clients who are female. A majority of our population identifies as Hispanic or Latino and Black or African American. Our population tends to skew on the younger side. A majority of our folks are under the age of 44. I think this skews a little bit younger than LA County homelessness data, but at the same time, as a prevention program, we are really trying to work upstream and catch folks before they fall into the homeless services system, as well as serve people who are disproportionately represented in populations experiencing homelessness. So while we're still undergoing a formal impact evaluation with California Policy Lab, we do consistently track immediate client outcomes, including program completion rate, as well as where clients are living at the time of discharge. Although our clients are quite challenging to reach and engage and enroll in the first place, we're happy to see that an overwhelming majority complete the program and stick with us all the way through to that 4 to 6 month planned discharge mark. Over the last few years, 90% of our clients retained permanent housing at the time of discharge. So even though this is short term, we definitely feel like this is a win, especially because we often find these clients just a few months earlier in times of real crisis. Maybe they've just gotten a verbal warning from their landlord. We've had clients who we call, they're actively going through the eviction process. We have had folks who just left the hospital, just left a job. So many of our clients remark that we found them at just the right time, and we feel the same way. Not everyone retains permanent housing throughout the program, and we just think that's also a testament to the efficacy of the model and finding the right people who are most at risk of losing their housing.
So as Claire mentioned, we're currently evaluating the Homeless Prevention Unit with a randomized controlled trial, and we have results anticipated next year. But in the interim, last year we wrote a report which looks at early outcomes from the program prior to the randomized trial. So we looked at 2022-23 pilot period. And I should emphasize that this is not a causal analysis. These are just associations where we're controlling for various kind of background covariates, but the results are encouraging. So HPU enrollment is associated with a 71% decrease in the use of interim housing or street outreach, as well as improvements in secondary outcomes like mental health crisis stabilizations and sheriff bookings. For the randomized controlled trial, we have a two-stage design. So our primary research question is, what is the effect of enrollment into HPU? So that's our main treatment control experiment. So the high-risk list that is referred to HPU is randomized into a treatment group that gets proactive outreach and a comparison group that doesn't get any outreach. It's kind of a pure control group. Nothing happens to them. And once people are enrolled in the program, we ask a secondary research question, which is, what is the effect of expanded financial assistance? Right, so with these two treatment arms, we're testing the effect of an additional $2,000 in flexible financial assistance. So to summarize everything that we talked about, homelessness prevention is likely effective. There's some pretty good evidence on that now, but targeting can be challenging, right, because of this issue with self-identification, which I talked about. So the HPU pilot attempts to solve this by taking an innovative, proactive approach. The predictive model equitably identifies a higher risk group. Because of this proactive approach, HPU identifies pretty unique clients that are disconnected from other prevention services and have more intensive service needs. HPU has a program model that's accessible, flexible, and client-centered. Proactive outreach is challenging, but as Claire talked about, with program changes, they're improving those enrollment rates, which is really encouraging. HPU participants are mostly women. Women are just more likely to respond to the offer of the program, and they're 38% Black and 42% Latinx, and there's an ongoing randomized controlled trial for causal impacts. So that is it. Thank you.